all, thank you for having me here, and thank you to all my listeners for joining in, and viewers, of course. I'm Dr. Meenakshi Ahuja. Currently, I'm an obstetrician and gynecologist. Currently, I'm working as Director of Obs and Gynae at Fortis La Farm. I'm also Academic Secretary of Delhi Gynae Forum. I'm President of Indian Menopause Society Delhi chapter, and I'm also Vice President of South Delhi IMA. So today we'll be talking about a very interesting topic, which everyone, I think all women need to be clear about and all men need to be clear about too, which is the menstrual cycle and what can go wrong and what you need to know about it. So what is the menstrual cycle or menses? These are your periods which occur probably at a clockwork of once a month, starting from the time we attain Meenakshi. Meenakshi is when you start your periods, which would be any time between 9 and 13, and till the time the periods go on and then they finish, and that is called menopause. This is what the menstrual cycle is like, and usually the bleeding would be anything between 3 and 5 or 7 days at max. And the cycle, which is what we count from the first day to the first day of the next period, should be roughly about 28 to 30 days, but anything between 21 and probably 35 to 40 days, as long as it is regular, is acceptable. So when we talk about why the menstrual cycle occurs, I guess we have to go back to our class 7 textbooks, which is where we learn that, for all women, the eggs are predetermined the day they are born. And they only start maturing once we reach Meenakshi, or once the period starts. So the eggs are actually in the ovary, and these are there as primordial follicles. There are millions of them, although all of them may not form active, healthy eggs. So once the eggs start growing and bursting in the middle of the cycle, and hormonal changes are occurring because of that. That is, in the first half of the cycle, estrogen is released. And in the second half, after ovulation, progesterone is released. The lining of the uterus acts by these hormones. And that is when the progesterone is released and it stops getting released, that the periods are going to occur. So if a woman is pregnant, the progesterone continues to be released and then she doesn't get her periods. And that's how women will not get their periods if they're pregnant. And otherwise, if you're not getting pregnant, because the progesterone will finish off, you will get your periods. So these are hormonal changes which are occurring in the body. By that, I mean the hormones are released, or hormones are just molecules which are released by the ovaries, right? Every woman has 2 ovaries, 1 uterus, 2 tubes. So the hormones are released by the ovary into the bloodstream. And into the bloodstream, the estrogen and progesterone acts all over your body, be it your heart, be it your skin, be it your hair, be it your bones, and keeps them strong. So while the time, all your life when you are getting your periods, your hormones are what are keeping the rest of your body as a woman in order also. That is taking care of your skin, your hair, your bones, your heart, and protecting it from a lot of diseases. And that is why menstruation actually heralds not only the beginning of your fertility, but also that your body balance as a woman is in place, right? So once the eggs start finishing off, or the quality becomes bad, and actually the quality starts becoming bad after 35, and that is why that complete stress about women wanting and should conceive by 30 or definitely by 35, because the egg quality starts deteriorating after 35. The numbers also deteriorate, and then many women will lead to either fertility issues and all. And that is why now once the eggs finish off, or the good eggs are not forming, the woman would reach menopause, her cycle start becoming irregular, and they will stop at a particular time. Normal age of menopause is anything between 40 and 55. And Indian women usually have a menopause around 46.2 years. So once these hormones stop getting secreted by the ovaries, because ovulation, like I said, is not occurring, so then the estrogen and progesterone is not there in the body. And it is not only that the periods are not happening, but what was protecting your skin, your bones, your hair, your heart, will stop, and that is why then women are more prone to diseases and aging diseases. And that is why it is said that while the periods are going on, if the periods are normal and going on by the clock, usually other hormonal issues are not occurring in the human body, right? So what are the problems which occur because of in the menstrual cycle? So the first thing that you should know is that probably when the periods start, this is for mothers of young girls as well as for young girls themselves, because the periods can start anything between 9 and 12. But if the periods don't start by 13, I think you should be seeing a gynecologist to see where things are going wrong. However, in the first couple of years, the cycles can be irregular because menstruation or rather ovulation is sporadic. It may occur once in 1 month, once in 2 months, once in 3 months, or even once in 6 months. And that is why the periods will not be occurring in time. However, once about a couple of years are done, and by then the cycle should pretty much regularize. And if the periods have not regularized after 2 years of menarche or starting periods, you should come and see a gynecologist and get that sorted, right? So I think the first reason why women would see a gynecologist is when they are having very heavy periods. So what do we mean by heavy periods? So normally periods would last, like I said, between 3 to 5 days or stretching up to 7. Few days may be spotting, few days may be light bleeding, and few days will be good bleeding. But usually there should be not any clots. If there are clots, that means the bleeding is abnormal. If we are having clots in the periods, that's definitely abnormal and needs to be seen. And what I mean is you need to see a gynecologist. It's not something which is drastic or dangerous, but we would like to see about what's going on and check if there are any fibroids in the uterus or any cysts in the ovaries which need addressing. But otherwise, there are very good medications available today which women can take to control heavy periods, because unnecessarily, if you're having heavy periods regularly and not taking care, you are losing a lot of blood. And if you're losing a lot of blood, you're getting anemic. And if you're getting anemic, then you're going to get tired sooner, your hemoglobin has dropped, your oxygen carrying capacity to all your muscles and tissues has gone. Your hair fall, there will be hair fall, there will be a dullness in your skin and dullness in your attitude, because also it's not only the muscle fatigue which is occurring because oxygen is not going to the muscles. Oxygen is not going to your brain also. And that is why you are going to have a lot of tiredness and you will not feel normal. And probably that is why, to correct, because you're just losing blood unnecessarily, if your periods are more than 5 to 6 days, or if they are coming more frequently, please see a doctor to confirm that there are no fibroids, there's no thickness of your endometrial lining occurring, there are no hormonal abnormalities occurring. Many times thyroid issues would also create period issues, and that is why we would probably do a complete hormonal profile, get an ultrasound done to see what's going wrong, but it can be addressed very easily. The second reason why you would like to see a doctor, that is when your cycle is not going right, that is when your periods become irregular. By irregular, I mean that if you're not having your periods, say for 2 months, then you have them after a month, then you have them after 3 months, or 45 days. This is not the regular pattern. And that means that there could be some issues which we need to sort out. So I think everyone today, every young woman, every mother of a young woman understands something about polycystic ovaries, right? So PCOS or polycystic ovaries or polycystic ovarian syndrome is extremely common in the urban areas, probably because as Indians, we all have the diabetic gene or the metabolic syndrome gene in our bodies, because all of us have probably a family history of diabetes somewhere or the other. And that is why we are all prone to it. However, if we are not, if the routine of exercise is not there, or probably, the diet goes wrong because of a lot of junk food and all. So that is when PCOS will become overt. And it can be corrected and it needs to be corrected. So if the cycle is irregular, or even if the cycle is regular and you are putting on weight unnecessarily, or you are trying to lose weight and it's not happening, or there is a problem in conceiving, or you are having hair fall, or there is a lot of acne or facial hair, pigmentation in your body, these all could be signs of PCOS, and you need to see a doctor because probably you will be put on medication to regularize your cycle. The first line treatment here is probably birth control pills, also along with diet and exercise. So lifestyle changes are definitely very, very important in PCOS, and your doctor will give you a lot of medication, or medications according to what you need for. But if you're put on birth control or combined oral contraceptive pills, there's nothing to get worried about, because that is something which is going to regularize your cycle. And the newer pills available today are extremely low dose. We have low dose pills and ultra low dose pills also, which don't have any side effects, will get your cycle in order, will correct the PCOS, will get the water retention down, will clear your skin out, will help you in the weight loss, will take care of your acne and also the facial hair. So definitely it is almost a blessing in disguise that if the cycle is irregular, that you see a doctor, and then if the diagnosis of PCOS is made with the lifestyle changes, medications, including combined oral contraceptive pills if required, these options should be discussed with your doctor. But definitely there's nothing to get scared and not see your doctor thinking that PCOS can't be treated or can't be cured. So when we say it can't be cured, what we mean is that because it's in your genetic makeup, we can definitely treat it, correct it. And then with lifestyle changes and modifications, you are going to keep it normal for the rest of your life. So that way it is corrected and controlled. So, I don't know if that counts as cure in your head or not, but I think that itself is a good enough way that, you can keep it corrected in your body, because like I said, it's in your genetic makeup. And there is no reason to think or get disappointed that we can't correct it. Also remember that later age, if you're a young girl who's having PCOS, and even if you're pretty okay thinking that, okay, I'm not getting my periods, it doesn't matter, I'm probably using pads less and I can, go out and enjoy on the beach or in the swimming pool just because for longer days because I'm not getting my periods. Remember that it also signifies that you're not ovulating properly. And if you're not ovulating properly, it means that at a later time, if and when you do desire children, that itself can also be an issue. And that is why PCOS corrected as soon as possible will never let them worsen. Your ovarian size and volume will become fine. Your cycles will be regular, and then later to conceive should not be a problem. But you definitely need to correct it if you want that at a later point of time. You should not have issues, conceiving. And that is, so it's not only the cosmetic changes as in weight gain, acne, facial hair, but even the point of conceiving issues. And it also puts you at a little more risk of things like endometrial cancer at later life. It also puts you at a greater risk of having diabetes in later life. And that is why it needs to be corrected as soon as possible. So what I'm trying to say is any irregular cycle, see your doctor, see if you have PCOS, maybe an ultrasound may be required to see PCOS or hormonal profile to see whether the reason is a thyroid disease. There are other hormones like prolactin, which also will be checked, because these also can lead to irregular cycles and can be corrected, like I said. So it's like coming back to the same point, always go to a regular menstrual period is a very good sign that things are pretty much normal inside your body. Coming to the next reason or issue why you may want to see a doctor is painful periods. So painful periods is a reality, and a lot of women, young women or slightly older women will have extremely painful periods. So it's not that, there are some people who don't have any pain in their periods, which actually also may not be such a great thing, because sometimes even anovulatory cycles are pain-free. So probably in the first 2 years, when you start periods, when the cycles are anovulatory, they may actually be pain-free. And after that, some people have pain during the period, some people don't have a pain. So there's something known as pain in the periods is called dysmenorrhea. So there's when we talk about dysmenorrhea, there is something known as spasmodic dysmenorrhea, and there's something known as congestive dysmenorrhea. So by spasmodic dysmenorrhea, I mean that your periods start getting a little painful even before your periods start. There's pain in your pelvis coming from your back, lower down. And probably once the periods start, in a day or two, it gets much better and gets relieved. So that, if you can manage with a single painkiller, again, of course, good idea to see a doctor once. But if you can manage with a regular painkiller, should be pretty fine. Continue exercising, have a lot of warm fluids. That will also make you feel much better with the painful periods and help you through it. So don't stop exercising during the periods, whether they are painful or not. Maybe you don't need to exercise like your routine, if it's a very stringent routine or a very difficult task routine as far as exercise are concerned, but a regular walk or doing mild stretches and all will actually help you with the pain also. Now coming to the second entity, that is congestive dysmenorrhea. So congestive dysmenorrhea means that the pain during your periods starts probably when your periods start, but as the cycle goes on, it progressively worsens. Now, that is not something which is acceptable, because it might be a sign of something else going wrong inside your body, which can be corrected again. So, again, you shouldn't ignore it. So, pain which progressively increases during your periods, or pelvic pain in the middle of your cycle at some point or the other, means that you are having congestive dysmenorrhea and could be a sign of endometriosis. So endometriosis, again, a word you keep on hearing all over the place, because I can't say whether it's becoming more common or not, but definitely it is at least being diagnosed more often. We look for it, so we find it. And then again, because it can be a cause of infertility later, once we correct it, things are much better. So I think most women suffer because endometriosis is not diagnosed or not picked up at the right time. There's almost a window of 5 to 7 years before endometriosis can be picked up. Unfortunately, it has that issue that the pain may be very severe and we might not see anything in your pelvis. And at the other hand, the pain may not be there at all. And we might see huge cysts inside the pelvis, which are blood-filled cysts or endometriotic cysts. So what happens in endometriosis? Like I said, that during our menstrual period, what exactly is happening is that the uterine lining is shed off. This lining is known as endometrium. So there might be endometrium-like endometriotic spots or tissues present in other areas of your body, which is not your inner side of your uterus. So these points might be present in your ovaries, may be present in your tubes, may be present in the peritoneum or the lining of your abdominal cavity, rarely even on the gut. In fact, there are people who have reported rare cases where this endometriotic tissue may be found even, say, near the lungs or the heart or the eyes also. And then there would be, or even in the urinary bladder, where also then every time, because like, remember I told you that the hormones are secreted in the ovaries when you're ovulating. The hormones are going in the bloodstream. And once the estrogen and progesterone is going in the bloodstream, it's going to go all over the body, right? So when, if there's endometriosis and there's endometriotic tissue outside the uterus, that is also going to respond to these hormones and it is going to increase. And when the progesterone goes down, there is going to be bleeding in that area. Now, the uterine cavity, the bleeding which occurs is just going to come out the vagina, from the cervix, through the vagina into outside where you use a pad. So, but the problem here is that if the bleeding is happening inside the body, it's going to collect inside the body. And if it's collecting inside some tissues, it is going to cause stretching of those tissues and it is going to cause pain and the stretching. And endometriotic pain can be really terrible. Now, the benefit now as science and as doctors now in so many years that we've started understanding endometriosis is that once diagnosed, or even if you suspect endometriosis, it needs to be treated. The problem with endometriosis, if it goes untreated, is that it is a progressive disease. So untreated, it can worsen, and there is no sort of way that I can say, it's going to worsen in 6 years or 2 years, because everyone's body behaves differently. However, untreated and it becomes worse, again, it can cause fertility problems, it will cause adhesions because the blood will leak out. The blood is collecting as big masses near the uterus, near your ovaries, near the tubes. And that is why it needs to be treated. Now, how do we treat endometriosis? There are a lot of lines of treatment of endometriosis, because endometriosis is more an estrogen hormone dependent issue. Probably giving long-term progesterone, that is the second half of the cycle. Progesterone works very well for management of endometriotic pain, and it also shrinks the endometriosis which is there. Pregnancy itself is a treatment for endometriosis, because for 9 months you're not going to get your periods. And that is why once you don't get your periods, there's not going to be any bleeding, and the blood inside will get resorbed like any other bruise in the body. And that is why there will be pain relief at that time. You may not be planning a pregnancy at that particular time. Maybe you're very young or you've had your children. But still, you need to treat the endometriosis, because the pain is only going to get more if it is not treated. And if we don't take care of it, even like I said, fertility issues can occur. I remember there was a time when, women used to come with a history of endometriosis with repeated laparoscopic surgeries. Patients had repeated removal of cysts because of the pain, and then finally even resorted to getting the uterus removed. Unfortunately, when the ovaries are left behind, the endometriosis will still continue. And that is why in surgeries, if we have to do a surgery for a woman with endometriosis at a later age, even the ovaries need to remove, because that is from where the estrogen is actually getting secreted. And that would lead to a situation of premature menopause. And again, the estrogen will not go to the body parts where it's required, like the heart and the skin and the bones. And that's where menopause issues will occur. So you have to do a very judicious judgment and understand that if you have endometriosis, it needs to be taken care of from the day we diagnose or suspect it till the time the periods finish, so that you don't end up getting unnecessary surgeries done. And so your gynecologist is going to continue taking care of it for the rest of your menstrual life, at least, because obviously we also want to avoid unnecessary surgeries as much as you do. And it is now a dictum that if a woman of endometriosis needs surgery, it should be only once in her lifetime at the maximum, where we try to give her the best option. And that also if she is having infertility or something intractable which can't be managed otherwise. So there are very good medications available for endometriosis in the form of progestogens like Dynagest. And also we use intrauterine levonorgestrel implants, which will also keep on slowly releasing progesterone, and at least not let the endometriosis worsen once we have managed it and got to a level where it can be controlled easily. So endometriosis is, in mind, it seems like a drastic diagnosis, but once it's made, you just need to understand that it needs to be taken care of so that it never reaches a stage where, you would require getting something like a surgery done, which you don't want to get done. But please, if you have pelvic pain, especially increasing during your periods, or even pelvic pain throughout your cycle, that is throughout the month, sometimes it could be an indication of endometriosis, and you must come and see your doctor. So these are the common things why women come to us with menstrual issues. The other menstrual issue that women may come to us is menopause. So like I told you, menopause is the cessation of the periods, when the cycle actually stops happening because the eggs have finished. So menopause can occur anytime from 40 to 55 years. If menopause, or if the cycle starts getting irregular and your eggs are finishing and your hormones are going low, before 40, we call it premature ovarian insufficiency. And that also needs to be treated and taken care of till your natural age of menopause, which would be, we would like to give that hormonal support till the age of 50 at least, so that the bone health and the cardiovascular health can also be taken care of. If a woman has a hysterectomy, now that's another thing, a woman may have fibroids or any other disease, or a lining may be thick. For some reason, she may require a uterine removal, which is known as a hysterectomy. So women get worried that once I stop my periods, my bones are going to suffer, my heart is going to suffer. So if she's still having her periods, when she decides to get the surgery done, if we leave her ovaries behind, the estrogen and progesterone, which, if you remember, I told you is secreted from the ovaries, continues to be secreted. She continues to form eggs. The estrogen and progesterone continues to go into the bloodstream and work on her skin, her mucosal membranes like the urethra or the urinary passages, the vaginal passages, the bones, the heart, and her other hormones. And that estrogen progesterone effect will remain. So that is the only case where when we are removing the uterus for some reason, but leaving the ovaries behind, the woman is not getting her periods, but she is not menopausal, because she will still get her menopause few years later when the ovaries stop functioning. Till the time the ovaries are there and they are functioning, there is no menopause. Her cycle continues to happen in her body, but not be seen as a menstrual cycle. So the estrogen progesterone cycle is still occurring, but there is no menstruation because there is no uterus, and the menstruation comes from the uterus itself. Now, when natural menopause occurs, the hormones are finishing off. And like I said, the heart, the bone, the skin is not protected anymore by the estrogen and progesterone, which is there in the body normally when you are menstruating. So that the side effects which happen because of that can be managed if there is a problem. So otherwise, we would just give a woman multivitamins, give her some calcium, give her vitamin D and whatever support, and get her body, her levels up to normal. But there are some instances where hormonal therapy, that is estrogen and progesterone or estrogen alone, may be required for that woman. That is, that if she's having a lot of hot flashes, if she's having night sweats, if they're interfering with her normal life, estrogen and progesterone therapy is fabulous, and it needs to be given to maintain, her sanity actually. So the estrogen and progesterone would be given because this is his deficiency of the fluctuation of the hormones which is causing it. So that's number one. If the hormonal therapy can be given, like I'd mentioned, for the premature ovarian insufficiency, also for protecting bone health and or for prevention of osteoporosis, along with vitamin D and calcium. In certain cases, if the bone mineral density is going bad, or there is another history of osteoporosis, or the woman comes in high risk, we can consider giving her hormonal therapy. Cases in which a woman has repeated urinary tract infections, or sexual issues because of dryness of the vagina, or even bleeding because of atrophic vagina, or pain down there because of issues of dryness, then local estrogen therapy works wonderfully. So don't think that hormones is a bad thing. It's not. Hormones, when given correctly, like if you're requiring it as a contraception while you're getting your periods, or as a treatment for PCOS, if there is there's an irregularity in the menstrual cycle, or hormones like progesterone given if you have endometriosis, or hormones like levonorgestrel, which is there in the intrauterine implants, which are given in endometriosis, or as a contraception, or in women with heavy menstrual periods, or hormones given in women who finish off with their cycles and are having menopausal symptoms. I think they are probably a blessing in disguise. And just when you understand that, although we think of hormones as foes because they are steroids or whatever, they actually can correct the deficiencies if they are occurring. And when these problems are occurring, be open to it and speak about these issues or problems if you're having, and see the best way that it can be corrected if you're suffering from any of these menstrual irregularities. Thank you. I think I've taken a lot of your time, over half an hour. And maybe we can see if we have any questions.
Yes, ma'am. We have some questions.
Yeah.
Yes. So there is a question that I experience irregularities in my periods after COVID. Does it has any connection with COVID-related stress?
So let me put it like that, there are two things here. One is COVID and one is stress. So stress at any point of time. I mean, I remember when we were in school so many years back, or if someone, and the exams were coming in, or there was a big tournament or a tennis match or a basketball match or something which is happening, there were a lot of girls whose cycles would go haywire. So stress itself, whether it is because of any other reason like an exam or tournament or COVID, or even COVID anxiety, is good enough or bad enough to cause irregular periods. COVID is a relatively new disease, but we have seen that, again, because of the stress that it's causing, or otherwise also, or some medications like blood thinners, which may be given in COVID for, cases where there were more problems, or steroids, which may be given, or sometimes maybe some medication is given. For that reason itself, the cycle may get irregular. But frankly, I would expect that even if your cycle was perfectly regular and gets irregular at the time of COVID, also because a person who say is a borderline PCO has been exercising regularly, eating very healthy, and then she has COVID, and then you stop eating healthy, and probably, you're feeling bad and having a lot of carbs in your diet, or you put on weight, or you're resting and not exercising. All these factors, will add up. And that will also cause issues in your cycle. But definitely in a couple of months, after you have recovered from COVID, if your cycle's not back to normal, please see a gynecologist.
Ma'am, we have another question. Can stress cause a woman to skip the menstrual cycle, and can we do something to prevent this?
Yeah, so, that's exactly what I said, that stress from any reason, be it relationship stress, be it work stress, be it, exam stress or something, it can cause a menstrual irregularity. But the point is that if it's so stress, there are two stresses, right? There's a stress which is going to continue all your life. If you're working, you're going to have that stress. It should become part of your life. So after that, also, if your cycle is getting irregular every month, you can't just say, "My office is, I have very bad hours in my office," but that's your lifestyle. So that means you need to correct that lifestyle, right? So I somehow feel that if you're trying to attribute it to stress, then it should be a one-off thing. If it's happening every month or every couple of months, or once in 3 months you're skipping your cycles, then you either change. I mean, there is definitely need to understand that it's affecting your body and to correct your lifestyle. And if after that also it doesn't get corrected, to seek professional help.
Also, ma'am, there is one question related to this question only. When there is like heavy bleeding, and how can we correct it and how to deal with that?
Yeah. So, like when I said that there's heavy bleeding, you're losing unnecessary blood. So a lot of people will say, okay, we should start eating iron tablets and all. That's okay. But the next month you're going to bleed and lose that hemoglobin again. So it's not a good thing. The point is that why you are having heavy bleeding. It could be anything from a bleeding disorder. It could be some medications or painkillers that you're taking regularly, which is causing increased bleeding. It could be even low dose aspirin that you're taking to protect your heart, which is causing heavy bleeding.
You are on mute, ma'am.
I don't know. I think I got lost somewhere. So if the bleeding is occurring as in clots, that means it's abnormal. There is medication available. But I think before that, you shouldn't be taking it on your own. there is support available, there's iron, vitamins, and everything that will be given, because heavy bleeding is going to cause other things also. It's going to cause, like I said, weakness, muscle pain, brain fogging, hair fall, dry skin. So at least see a doctor, see if there's a reason for it. Say if you have a fibroid inside your uterine cavity, outside your uterine cavity, or you have ovarian cyst which requires something like birth control. Whatever it's required, depending on what the problem occurs, you must try and get it sorted out, rather than just thinking कि अच्छा मैंने iron tablet या vitamin खा लिया या extra large pad use कर लिया and that's the solution to the whole thing. No, it isn't. It's signifying that there's some menstrual irregularity and you must see a doctor for it so that you correct it.
Also, ma'am, while working, we get a question from young adolescents, like, can they be pregnant even if they are having excruciating periods pain?
If they're having excruciating period pain, but they're having their periods or not?
They are having their periods, they are having excruciating pain, and which is an indication of some medical issue. So we get this question very frequently.
The point is that you must understand that period pain can be normal. Period pain can be endometriosis, in which, like I said, that, or even pelvic infection, you could be having severe pain. But the point is, if you're having unprotected sex, the first thing that you should think of is pregnancy. And of course, you might be bleeding and thinking that, my periods are otherwise irregular. And it could be signaling that either you're aborting, you're having an early biochemical pregnancy with a miscarriage, or that you're having a tubal pregnancy, which could be a life-threatening thing. So that is why all these, post-coital pills like eye pills and all, we don't recommend, because they bungle up your cycle. You might think it's your period and you might be having excruciating pain. And unfortunately, there may be a pregnancy in the tube which is bursting, which could be a life-threatening condition. So emergency contraceptive pills are exactly that. They're meant for an emergency, and an emergency should occur once or twice in your lifetime. Because it's an emergency, you go with the risks which are there at that time. But as a routine, to think that they are effective contraceptives is an extremely wrong notion. And if you're seeking a good contraceptive, again, I think your gynecologist should be your confidant. You should be able to discuss your issues with them and definitely seek options and decide along with her or him whatever works best.
Yes, ma'am. So we have another question, that does COVID vaccination impacts the menstrual cycle in any way?
So in all fairness, again, the same thing. There are a lot of people who've been stressed about the vaccine. And people who are stressed about the vaccine are usually the ones who would have irregularity. So, statistically, it's not been proven that it causes irregular cycles or fertility issues. In fact, it's a killed vaccine. You start getting vaccines from the day you're born. The day you're born, there's a BCG shot which goes up in your arm. You get polio drops, you get DPT injections. You get, once you're growing up, you get mumps, measles, rubella, you get the cervical cancer prevention vaccine. You are supposed to get the hepatitis B vaccination. The vaccinations, flu vaccine is given every year. COVID vaccine is much like a flu vaccine because that's also against a virus like that. So I guess now that probably we are going to have like flu vaccines, COVID vaccines and boosters every year, slowly, because people will get used to it as a routine. I don't see menstrual irregularities because of any other vaccine. So I guess still this stress has a role to play. And probably in a few years, once it becomes the norm to get these vaccines or they're not required, we probably won't even see these little irregularities we've seen in some people.
Thank you so much.
Then I said that if there is an irregularity because of the stress, then I'm ready to accept it. But then in 2 months, it should get okay. And then your cycle should be back to normal. If it's still not back to normal, then it's not because of the vaccine. It's just that something else happened coincidentally. We used to have patients who used to tell us so many years back, कि जब से मेरी शादी हुई मेरे cycles irregular हो गए. Now that means nothing. It's not that तुम शादी के 7 फेरे ले रहे हो तो उससे आपकी cycle irregular हो गई ना. It's not possible, practically speaking. It's a change in lifestyle which happened after that, or the stress that happened after that. So that is why it's very important that if it's not an event which is causing it, it's a stress which may be associated with, or the change in lifestyle that you've done with it. And if it's regularly happening, you're associating it with that event. But it is not something which I would consider the norm, and it needs to be corrected.
Thank you so much for answering this question, ma'am. We have another question that any lifestyle modification do you suggest for patients of endometriosis?
See, pelvic pain does very well with regular exercise. And I can understand endometriotic pain can be extremely excruciating. But one thing which I've seen has made people much better with endometriosis, except, of course, the medication. The medications are excellent. And now the newer ones that we have don't cause any side effects and all. And they're really a blessing to all the girls. But definitely, I would say there are on the internet, I'm sure there are a lot of foods that if you take this, if you avoid dairy, you will do better and all. But probably if you say one thing which really helps, I would say having a regular exercise routine. It will definitely keep your pain less than normal and probably make you stronger and fitter and more accepting to the pain also.
Ma'am, we have another question that is a 35-day cycle normal?
Yeah, if your cycle, so when I say 21 to 35-day cycle, that is the window that we give for a normal menstrual cycle. If you have a regular 35-day cycle, there's no problem about it. Similarly, if your cycle is 24 days, there's no problem about it. It doesn't need to be 28 to 30 days. But at the same time, it can't be that in 1 month it's 24 days and 1 month it's 35. That is what is called an irregular cycle. So by and large, if your cycle is between 25 and 35, but whatever number you've decided it is, it's a couple of days aage piche. That is acceptable and that is not. But yeah, a 45 or a 50-day cycle, see a doctor and see there's nothing else going wrong inside.
So well said, ma'am. One last question from my side. That while working with endometriosis warriors, we, listen to them and get to know that there is, social stigma of normalization of periods pain in society, and they are struggling for the diagnosis. So how endometriosis warriors can cope with that situation?
I agree with you. I think sometimes the problem is, I think more sessions like this, where we talk about endometriosis. There are certain countries now, I think Spain has now started giving a period, a holiday for 3 days for period pain, right? It's not about normalizing the issue of period pain. It's not about normalizing the pain, ki nahi, ye nahi ho sakta. It's about normalizing the issue of period pain, that some people do have severe pain. It is a medical issue and they require, so it's not that they're trying to run away from work. Unfortunately, the problem is that, if you have a boil on your face or you have high fever, it shows. You can't carry your pads to work, or you can't kind of quantify the pain that you're having or the heavy breathing that someone may be having. So it's very sad also that, that from school, even to escape sports period, people used to use the excuse that periods are painful and period pain ho hai. So I think as women, we must all learn not to make light of this. So respect this problem as a problem and don't use it as an excuse, so that women who are actually suffering from the pain can actually be respected and their pain can be respected, that it's not like PMS. Again, that's another entity. People think it's a joke, but women who suffer from PMS can go to the level of even having suicidal thoughts and tendencies. So just to say that anyone's in a bad mood, tum to PMS kar rahi ho ya PMS, it's trivializing the issue. So I would say respect period pain and not trivialize it. The woman who is complaining of period pain, if it can be really excruciating. Definitely she should seek medical help. And if there is, probably, and we as doctors also, because the disease is such or the problem is such that so many times you do an ultrasound and you don't get anything. So the diagnosis becomes difficult. Then you don't know whether the person is malingering or she actually has pain. Then people, get false certificates done. So now that's the issue in our country. So probably once we understand that we should respect women who actually have pain, there's a diagnosis which is made in time, or they are on some medication or medical support, and they have certificates. I think definitely period pain needs to be respected more than what it is being today. I hope that answers your question.
Yes, ma'am, definitely. And there is one last question that, ma'am, as each lady wish everyone one cycle, but during treatment, mine did not have period. How do you counsel these patients?
So the point is that when we are see, I think counseling is a very important part of any problem which is there, right? I can't just write medicines and say you go away. You have to give the patient a patient hearing. I guess that's the signal when you have a patient in front of you. And you have to give a patient hearing. You have to understand her problems. You have to understand her concerns about the illness and her concerns about the treatment that she will take. You also need to explain to her that what are the, I wouldn't say problems, but what she should expect while she's on treatment. So women who are on endometriosis are given medications. These are progesterones and they need to be given continuously. In fact, even if we give them birth control pills, the correct way to take it for endometriosis is to take it continuously. You may be given injections which have to be taken every month, but you will not get your periods during that month. That is the only way that the pain will go away. And the existing disease which is there, or the cysts which are there in your body, will shrink. And the pain will go away once we stop the treatment. So that you have to understand, the periods will not happen. In fact, the problem is when you are taking treatment and your periods are happening, that's when we don't know whether the disease is shrinking or not, or we are getting the prerequisite results or not. So if the counseling is there that don't expect your periods, and they might happen in between at some time while you're taking treatment, it doesn't matter. And only if they are troublesome, that is that, you keep on having spotting for 10 days or 15 days, which is obviously a nuisance and interferes with your normal life and lifestyle, that's when you need to see your doctor and your gynecologist, get back to her. But definitely before you start treatment, it's extremely important to understand that it's not, I wouldn't even call it a side effect. It is expected. But if your doctor's not told you that you're not going to get your periods while you're on treatment, obviously you can't accept it.
Yes, ma'am. So we are towards the end of this session with the last question, that how is the gynec community contributing to the various myths that exist in the field of women's health?
I think what I'm doing today is part of it. So I guess with the gynecological committee, you understand that gynacs are extremely busy people also, as in any other profession. I respect every profession for it. But as working women, I would put it like that. I wouldn't put it as gynacs. As working women, you know that the burden of home, family, work, everything is there. It doesn't get less. And I guess I can't say that every gynecologist should be contributing or it's her duty and responsibility. No, her duty and responsibility is to treat you when you go to her. She's a doctor. You have to go to her as a patient and she is going to treat you for it. However, there are some people who are very passionate about, disseminating knowledge. I may like it and I like to do it and I like to share experiences. I like my patients to share it. I might be very active on Instagram to give information to youngsters on this. It might not be every gynecologist's cup of tea, and I wouldn't blame them for it. So to think of it, I mean, you have to understand, it's not your right to demand it out of your gynecologist. You can do this only as a passion because it takes out of your free time, or I block my OPD when I'm talking to you or on a forum, or I'm not spending that time with my child. And, What I mean is anyone else who's working office 9 to 4 is not expected to take out time after that and do something. Na? I have a family, I have a home. So don't expect it as a right. But at the same time, I think as gynecologists, as doctors, we should be empathetic. So when a patient is there with me, with it, it's my duty. I would feel that time at least it's my duty and responsibility to give her a patient hearing and understand what she goes through, what are her issues, and sort it out for her. And probably be approachable whenever she visits me with any problem. But as a gynecological committee, and frankly, as a pharma community also, there's a lot which is being done now to disseminate this knowledge. Talk about, that's the advantage. I think with COVID also, all of us have learned to communicate virtually. And with communicating virtually, that's where we've learned it's not a one-on-one. I may be speaking to you, but there may be hundreds who might be listening, or there's a video where they can go and connect in later and get that information. So if as a community, we learn to give a little bit of our time, because I don't think it's as a gynecologist, I think it's as a human being that you must learn to give back to community what you've got. So if I can give little time to explain or to get patient hearing or to explain to people that, okay, if there's a problem, you come and see us, or I think it goes a long way in getting confidence. So that's probably the way I would look at it rather than saying. So pharma community, again, their responsibility and duty is to make internationally available drugs available to us as a treatment modality as soon as possible. But then there are communities in the pharma community who feel that they should give back. They may have projects like, Save the Uterus, or say Freedom from Pain, or something where they talk about, they go beyond their sense of a business house. So it's just about giving back, which I don't think it's as a doctor or pharma. You are here, you're sitting here. You communicate with a lot of people who have the problem. So I think as a human being, you should just give back to the community. You get a lot from it. So I guess that's the way I would look at it.
Thank you, Dr. Meenakshi. Just one last question. In spite of all the efforts that everyone is doing, there's still a lot of myths and misconceptions around menstruation, even in very educated families. So in your opinion, how do you think we should, or what is your advice to organizations like ours to dispel these myths and misconceptions? What more can be done to bring some awareness around all those, beliefs that people have?
I think you're doing a fabulous job. You have to start with whatever funds and whatever time that you have to give back and to be available and disseminate knowledge. You can't, you can take a horse to the water, you can't force it to drink. You can have information. There have to be people looking for information. But I've been in private practice for almost 28, 30 years now. Times are really different. What it was 10 years back, 15 years back, it's very different now. People are getting more and more information. Women come asking for contraception. Women come asking for pap smears. Women come talking about their problems. And people read up about endometriosis, or if they will at least Google pelvic pain and understand that endometriosis may be one of the reasons. And then they just need to search and look for. So I think information being available is more important. You people are pioneers in this. Information in, I would say, freedom from pain, liberating women, talking about menstrual cycles. And now that, on Instagram, I see there's so many pages, so many, what do you call them, Instagram handles where people talk about periods and all. And I think most importantly, what has changed in the community is that boys and men talk about it. Women are very comfortable talking to their husbands, their boyfriends, their brothers. My daughter will not hesitating telling her brother that I'm not going for a swim today because I'm having my periods. Or my brother will say, oh, she's, it's not called they're on the bad days or something. I mean, you talk about it as a normal thing. So same, I think, with friends and all. So I think just talking about it makes a great difference. We have to be patient about it. I remember 10 years back, no one wanted the cervical cancer prevention vaccination. But we kept on working towards it. Today, women know that their daughters have to get it done. Their pediatricians talk about. So it's, I think, getting information and trying to disseminate it and being patient. Definitely 5 years later, we have to be patient, but we have to carry on. It can be very difficult sometimes that you feel that, there are a lot of people who are still not getting that information and all. But the way IT, technology, dissemination of information is going, I think definitely there are better days ahead.
Great insights, ma'am. Patience is the key, and keep working towards your goal.
Yes. Yeah.
And of course, people are now talking about it, so there is some progress, and we have to just keep spreading the information, and that is how we can manage to reach every woman who wants the information. So thank you so much for your talk today.
My pleasure.
Back
Thank
to
you so much for having me on this platform.
Thank you, ma'am. Back to you, Khushbu.
Thank you so much, ma'am, for answering all the questions really well. And we will be in touch for further more sessions like this. And thank you so much for giving time from a busy schedule on a weekday.
Thank you so much for having me.
Thank you so much,
Bye.
everyone, for joining. Bye-bye.
Bye.
Thank you so much, Dr.